Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about ovarian tumors. We start with epithelial tumors. They could be serous, mucinous. Serous and mucinous are the most common. Serous type derive from the fallopian tube, and mucinous derived from the cervix. Brenner derived from endothelium, and endometrio derived from endometrium. Brenner and endometrial are metaplasia. That means normal epithelium undergo neoplastic transformation. Serous tumor, most common type, they are bilateral, they are benign, borderline malignant. Psammoma body are stroma calcification. There is BRCA1 gene mutation. That means breast cancer and tumor of fallopian tube. The prophylaxis for this tumor is mastectomy and salpingo-oophorectomy. Mucinous tumor derived from the same epithelium that form the cervix. They can reach very large size before they are detected, leading to rupture in the peritoneum known as pseudo-myxoma peritonei. Most common are not ovarian, but appendix tumor which metastasize to ovary. Mucinous tumors are radio and chemoresistant. Differential with Krukenberg tumor, metastasis of ovary. Endometrious tumor, they derive from the same epithelium of uterus, usually malignant. Ovary undergo metaplasia into endometrial epithelium and neoplastic transformation. Endometriosis, endometrial tissue out of the uterus. 50% associate with endometrial carcinoma. Check the patient for endometrial carcinoma. Brenner tumor most contain transitional epithelium, which is the same epithelium that forms the bladder urinary system, known as borderline cell rest. Cord tumor contain granulosa cell, theca cell, Sertoli Leydig cell. Granulosa cell tumor, they come from any age and secrete estrogen. They contain Karl-Exner body eosinophil deposit, and they occur in precocious puberty with a growing fast, and in the postmenopausal bleeding for adult because of estrogen. The second category is fibroma. Fibroma is associated with ascites and right pleural effusion. This is the mixed syndrome. Right pleural effusion plus ascites plus fibroma of ovary. The third category is androblastoma, the same as Sertoli Leydig cell tumor. It secretes androgen, heterosexual precocious puberty. It's associated with Pudge's syndrome, GIT discoloration of oral cavity, and polyp of the colon. Germ-cell tumor, precursor cell of gamete, granular cell fibromatica, fibroblast, fibroma. 3 categories: fetal tissue teratoma, germ cell dysgerminoma, choriocarcinoma for placenta, and Yolk sac tumor. Teratoma, benign. If localization in thyroid, look for thyrotoxicose. If localization in the skin, look for malignancy of squamous cell carcinoma. Most of the time are benign. Granulosa cell tumor, look for estrogen, exoner body. If menopause, look for metrorrhagia because estrogen. Choriocarcinoma, it's a tumor of the placenta. Yolk sac tumor, under 4 years of age, increase alpha-fetoprotein, and there is the presence of Schiller-Diver body, which are a prestige of nephron. Germ cell dysgerminoma, look for an increase of LDH, Turner syndrome, and the equivalent of sertoli in male. The last one is Krukenberg tumor, metastasis of mucinous tumor into ovary. They are bilateral. Most common primary site is gastric carcinoma. There is a signet ring cell nuclei derivated to the periphery because of increased amount of mucin. Differential with primary mucinous tumor of ovary, Krukenberg is bilateral. Epithelial tumor. Serous and mucinous are the most common. Serous tube derived for the fallopian tube, mucinous derived from the cervix, Brenner and endometrium derived from endometrium. Brenner and endometriode are metaplasia. Cord tumor, granulosa cell tumor, fibroma associated with ascites, pleural effusion, and benign fibroma of ovary. Androblastoma, the same as sertolideic tumor, secrete androgen and associated with Purge syndrome. Germ cell tumor, think of granulosa cell tumor, increase estrogen. Teratoma benign, if in thyroid, thyrotoxicose, if in the skin, adenocarcinoma. Placenta, think about choriocarcinoma. And Yolk cell tumor, increase alpha-fetoprotein under 4 years of age, and glomerular Schiller-Diver body. Germ cell dysgerminoma, think about tumor, increase of LDH. Krukenberg tumor, metastasis of mucinous tumor into ovary, bilateral. Most common primary site is gastric carcinoma. Signet ring cell nuclei derivate for the periphery because of increased amount of mucin. Differential with primary mucinous tumor of ovary, Krukenberg is bilateral. Please support the channel by buying this Kindle ebook, The Mysterious Weaver. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.